I'd be happy to, and I'm happy to be here. I work as a psychiatrist at Vanderbilt, have worked in primarily outpatient clinics my entire career. I'm a Nashvilleian. I went to high school here and went to medical school in Memphis and trained in Chicago and then came back to Vanderbilt 17 years ago. So I also was involved for 5 years with the mayor's behavioral health and wellness advisory group, and that's where I primarily started working with the health department and was impressed with what you do and appreciated a phone call asking me to consider joining you all. So I'm happy to be here and look forward to finding out the rules of what we do and how to work the equipment. But I'm happy to be here.
And you are also on the mayor's community safety
You and I worked together there a little
advisory group.
Exactly.
Yes, for a couple of years. So so thank you for agreeing to serve. It's good to have you and look forward to getting to know you over the next few years.
Yes.
So,
I
and
think I'm
let's just,
technically here for 5 months, filling out a term, but
okay. Well, we'll see.
we'll see how that goes.
Yes. And let's just quickly go around so we can just name and affiliation, and then we'll go ahead and get started with the meeting.
Welcome. It's great to have you. I'm Heather Coram Powell. I'm the CEO for the Tennessee Kidney Foundation, just down the street, and just great to have you here.
Hi, I'm Rebecca Whitehead, and I have spent the last 8 years in behavioral health, actually, and just recently went back to consulting. So I'm with the Gunter Group now.
Hi, Carol Ziegler. I'm with the Vanderbilt School of Nursing.
Today, I'm also consulting, but I have a background in public health and also health policy, particularly Medicaid policy. It's good to be here.
Hi, I'm Professor Emerita at Vanderbilt in health policy. I'm an internist and epidemiologist.
And we already know, well, just round it out.
Yeah, we've met and spoken a couple of times. Somi Ariola, I'm the director for the department. Welcome to the board. Yeah.
Dr. Stovall, I'm Derek Smith. I'm senior counsel with the Metropolitan Department of Law, legal counsel for the board and the department, among other metro boards, commissions, and departments. They're one of my fairly most active boards ever since the COVID epidemic hit.
Yeah, favorite.
Well, you're very active, and it's been a pleasure. But anyway, and I hope to continue in the role.
And then a lot of folks in the audience are members of the health department who keep us safe every day wearing their public health hats. And so you'll get to know folks as they come up and present and as you move through your tenure with us. So, okay, thank you. All right, let's go ahead and get started. And I think we can probably get out here at a relatively decent hour, as long as we just keep it moving, which I am all for today. Public comment on agenda items, and then community voices. Did we have anyone to sign up for either? Okay, so every month we have an opportunity for individuals from the public to make comments on agenda items. That's the public comment on agenda items. And then community voices is anyone who wants to make a comment related to the work that we do in public health. So that is those are two standing items on the agenda. Declarations of conflicts, recusals, or communiques from the board on any agenda items. Has anyone communicated with each other regarding any of the agenda items? Any declarations? Okay, hearing none, that we can keep it moving. And next, deliberation of the November 13th meeting minutes. And when ready, I will entertain a motion.
Move to approve.
Motion made by Dr. Griffin.
Second.
Seconded by Dr. Ziegler.
Thank you.
Seconded by Dr. Ziegler. Any discussion? All right, all in favor? All right, none opposed, motion carries. Next, we have Dr. Ariola, employee team recognition.
Thank you, Chair Franklin, and good afternoon, members of the Board of Health. Happy holidays. I forgot my proper season attire, but I'll remember next time. So we've got Employee of the Month, Kinley Reed. She's not here. I did meet with her yesterday, took this picture with her. And you recollect that recently we dealt with the measles outbreak that required a lot of work. I think in the director's report, you see some of the additional information. We did reach out to over 700 contacts, worked extensively with the Tennessee Department of Health, immediately got our employees trained and ready to do contact tracing, a lot of work reaching out to Vanderbilt clinics and other entities that were potentially involved in the response. So lots of work and keeping up with that. So the Kinley was recommended for that because of her work, and the statement here said that she remained positive throughout the process, communicated information in a respectful and clear way. She made herself readily available to any team members with questions and encouraged us throughout the investigation. So nominated by her PL Dale Chrisley, and I just wanted to, I know she's not here, she had a meeting to attend, but that's our Employee of the Month, Kinley Reid.
All right, thank you.
Our Team of the Month, and I know some of them are here. Dr. Dodd and your team, if you will stand, is our occupational health team. And they were recognized for excellence in teamwork, excellence in motivation, inspiring a positive attitude, exemplifying the mission and core values of MPHD. And, there's an email from one of their patients who's a Metro Police officer. And just wanted to thank everyone for their great work. I was just in, and as usual, everyone was kind and very attentive. I appreciate you all, and thank you for taking extra time to help me understand what my needs were and then providing me with options on how to achieve them. Again, our Team of the Month, Occupational Health Team. Yeah.
Congratulations, and thank you for your service.
And I do want to say Ben Michael is here, that's Dr. Dodd, and that's Diana here, and then that's Laura. Those are team members that are present.
Fantastic. Thank you.
And I'll take an additional privilege. Last month, because a WIC vendor management team, our Team of the Month, were not here. It's okay if you guys say, yeah. I did not do, okay, Diana, is any of our team, I really did not recognize them appropriately, so I wanted to, again, do the same thing, that they were recognized for excellence in teamwork, inspiring a positive attitude, exemplifying the mission and core values of public health. And, they talked about Stephanie Egan, Maggie Sanchez of the WIC vendor management team regarding their dedication, professionalism, and collaborative spirit. They talked about how they consistently go above and beyond to ensure that WIC vendors are supported, compliant, and well-informed. Again, last time I just didn't do the recognition, and so thank you for the opportunity to correct my error. We express that to your team. We are appreciative of all that they do. Thank you.
Thank you, Dr. Ariola. Next, we have the presentation, Oral Health Services Review. Hi.
Nice to be here. Thanks for having me. Derek, twice in 1 week. Besties. My name is Dr. Smith. I'm here to speak to you about oral health services. I'm the director, and let's talk dental. I have a couple handouts for you. Just flip through it, and you'll see how kid-friendly we are. I wanted to just take the first moments to talk about our dedication to the residents of Davidson County. This person came in, and yes, I brought my own laser pointer. This person came in. Oh, God, it's not working. Oh, there we go. This person came in. She was a 32-year-old. She was clearly in pain, swollen, crying, and she said, I need this tooth out today. If you could see, this is the tooth we're talking about. It's got that big black cloud. That's all lost tooth structure or decay. I saw this tooth before I even saw her. And this, for any general dentist, is referral all day. Straight to oral surgery. Absolutely not. I'm not going to touch this tooth. That is because this tooth is partially bony impacted. The only part of the tooth I could actually see was this top little corner right here. This is a wisdom tooth. Also, the amount of decay surpasses the amount of crown structure there. So the second you touch it, this tooth is going to crumble into pieces, and you're taking it out piece by piece in a section of the mouth you can't even see. In addition to that, her roots, do you see the curve on this root? And how this tooth is tilted distally, meaning towards the back? The roots were like this when I got the tooth out. I was very grateful to have gotten this tooth out. And one more thing, this canal right here, I'll try and show you on all these TVs. We'll show up on that one.
It doesn't show, yeah,
Yeah.
it's not showing up
Okay.
at all.
This canal right here, that's her mental nerve. And her roots are wrapped around that mental nerve. So if I sever that, she's going to lose feeling all the way from the angle of the mandible to the mid-chin. I did not want to touch this patient, and she told me, you have to. And I said, explain to me why. Like, I would rather send you to oral surgery. She said, because I have to go to jail tomorrow for 8 months. And this is a person who was swollen, crying, and apparently there's no dentist in this particular place she was headed to. So we worked tirelessly all day long, even past our end time. We worked through our lunches. We got all of her fillings done. I got this tooth out, and I know that I'm sending her to jail, but she's not going to be in pain for 8 months. And all that while we're seeing our regularly scheduled pediatric patients. So we were really working hard for this person. She was a Davidson County resident. So I just wanted to impress how much our team cares. It really mattered to us, and we did not want her to go to jail. First of all, going to jail at all sounds awful, and then have to deal with this for 8 months. That sounds misery. She would have had to gone to the hospital a couple times for this tooth. Also, her going to the jail story wasn't that juicy, so I was going to refer her. There are 3 branches to dental. We have Lent Dental, which is right downstairs. It's comprehensive, affordable pediatric dental care and emergency adult care. There are a lot of people in this building who work here that don't know we have a fully functioning dental practice right downstairs. It's in Suite 230, and if you've ever met a lame dentist, they'll tell you this joke, what's a dentist's favorite time of day? And it's 2:30. Please don't tell anybody you heard that from me. We also have WIC Dental. We are the only program in Tennessee that has this. We have a hygienist in WIC that when these families stop by each of their specialists, they also stop and see a dental hygienist, even maybe before their baby is born. We are teaching them how to care for their child's teeth, even the children they have, and how to care for their teeth and get them started off on the right foot. We focus on education for prevention rather than restoration. So hopefully the cavities don't even show up in these kids. We also have school-based dental prevention program. It's school-based dental. We go to schools that are on 50% or more free or reduced lunches. So we go to the lesser served. And this year is new, we're also doing high schools. So we're pre-K through high school, and we provide them with free sealants, fluoride, education, referrals, you name it. These hygienists do it all, and they're really wonderful. This is our dental office downstairs. You can see I've personally, in the last few years especially, I've worked really hard to make it more kid-friendly. We do draw on the floors, but it's wipeable with just an alcoholic wipe. But we have a hopscotch there. The kids absolutely love that, and they will do it all the way down the hallway and all the way back. We have over 80 bilingual books for all grades, and they're arranged by grade as well. We have friendly, artwork and that kind of stuff. And I passed out these handouts. Yeah,
Is this
they
what you're- oh,
they
no.
get prizes at the end of their visit, or even if they're nervous. And if you don't know Bluey, I'm sure you will one day. And they are just so excited when they see these, because that's a character they recognize. Also, all those handouts that you're holding, Dr. Franklin, those didn't exist before I came along. They're all kid-friendly.
And they're bilingual.
And they're bilingual. They're actually trilingual. I have Arabic downstairs. And they're meant to be simple language. And what I'm trying to do is make the dentist not a scary place for kids, because even their parents come in and they're scared too. So it's all kid-friendly, and they seem to love it. This is Pearl. It's our dental mascot that goes to schools. Yes, that's a hygienist in there. I think that day it was Tammy. I have been in this costume before. It is sweaty and unpleasant, but the kids absolutely love it. They go nuts when they see one of these hygienists walk out in this costume, and they just go wild. And they listen, and they want to learn about oral health and hug her. And I'm sure she's sweating in that right there, but it is really fun to see how excited they get. This is actually our reality. This is our everyday. I don't know if there is a day where a kid doesn't come in and they look something like this. This is not an emergency to me. I see this every single day. And that's a tough pill to swallow for parents to bring their kids in, like, can you help? And we are the first dental professionals these kids and maybe the families have ever met. They've never heard of a tooth doctor. So we're happy to be that person, and we want to be, moreover. So the reason oral health matters so much, especially for these kids, is that a student with tooth pain is definitely not learning. Like, they don't want to be there. They're crying. It's just not fair. Dental pain results in 34 million lost school hours for children per year. So it's our job to help keep those kids in class where they belong. That's their job, so let's do our job. These are just some fun numbers from last year. Lent Dental, our downstairs office, did over 14,000 dental procedures. And for example, you'll see how hard we work, 266 extractions in that year. That means per month we're doing at least 20 extractions, removing teeth. In WIC Dental, we did over 6,500 procedures. For the most part, that will be just fluoride, silver diamine fluoride, and education for the parents and the children. And school-based dental, they educated over 19,000 students, screened over 6,000, and sealed over 20,000 teeth. That's a pretty amazing thing. About 1/3 of the kids we saw needed to be referred for treatment. So even their parents were alerted, hey, there's something going on here, you need to bring your child to a dentist. And we give them a list of places to go. We include ourselves on that list, and they are free to go wherever they want. Maybe they have a dentist already, and we're happy to help. To put it money-wise, money makes the world go round, right? So you'll understand it maybe this way. Sealants, for example, at private practice, they would cost around $55 per tooth. So if we've sealed 20,000 teeth last year, that would equate to saving these families $1.13 million. That's a ton. So adding it all up, we've provided almost $3 million worth of dental treatment and free services for these children. So we like to show up and show out. I would be remiss if I didn't speak about community water fluoridation. It is known as one of the top public health achievements of the 20th century. Every dollar of fluoridation saves $38 of dental treatment per person per year. That might not sound like a lot, but to a certain family, that could be whether or not they get groceries that day. So it really does make a difference. And it's the safest, simplest way to capture entire communities, because fluoridation even benefits the underserved or underinsured. So if you've tuned me out, the one thing I want you to take home is how to spell fluoride. So just wake up from your nap for just 1 second. So it starts with an F. What's next?
L.
What's next? U. Yeah, you said U. I saw it. Everybody was like, You will never forget how to spell it after this. It's fluoride. I got that wrong on a test, and I've never, ever forgotten how to spell this word. So if you have any takeaway from this, please, now you know how to spell fluoride. Opportunities for our program, in my hopes to grow it and expand our reach, is to add a hygienist position for both Lentz Dental, because we see so many kids, And the starting point is getting a dental cleaning and getting your education, learning how to take care of your teeth. And an RDH position for WIC Dental. We only have one hygienist, and she splits her time between 2 locations. So if I had a second full-time hygienist, I could cover both locations 5 days a week. And that would capture every family that comes in instead of just maybe half. Also, I have been doing research. There is an AI program compatible with our dental software. I have put in a request for funding for that, because if you're not on board with AI, you better get on board, because it's here. I'm happy to take questions. I hope you enjoyed it, and this is Oral Health Services.
So, always have lots of questions, but the only question I'm going to ask is, how is this program funded? What is the funding stream? And how do we understand it? Yeah.
There's two separate funding streams. WIC Dental and Lentz Dental are on local budget. The school-based program is a statewide program, and it is a grant funded through TennCare. And we receive that through the Tennessee Department of Health.
Thank you. Yes, please.
I have a dumb question. What are sealants and why?
Oh,
Yeah,
okay.
I don't really understand what that is.
Right. So you've punched a hole in your drywall, and you can see cracks, right? Sealant smooths all that over. So then when you're eating, the food isn't getting caught in those crevices. Kids don't brush their teeth well enough to get all that out. So if you put a little sealant over it, which is just you paint it on, cure it, and it's on there, it makes the tooth nice and smooth. The food slides right off.
Just another payment question. I appreciate what you're doing. It's great. Do you bill Medicaid for any of the services? Do you guys have to bill, or does Medicaid? But Medicaid pays for some dental services outside the.
TennCare funds are school-based, and we take TennCare in our Lentz Dental program. We're not on Medicare. We don't deal with
Medicaid.
Medicaid.
TennCare.
Oh, TennCare.
TennCare, yes. Sorry.
Yeah, we
Yeah.
take TennCare and we take self-pay.
So first, thank you. It's amazing work and amazing numbers. And I just want to share with you all, as a primary care practitioner for 20 years, the thing that would always get people to come to health fairs was dental. Like twice a year, if we offer dental care, because everyone needs it, no one can afford it. So it's huge. You didn't mention the link between chronic disease. I know you don't have time, but there's a huge link between chronic disease and dental health. So this, like, it goes way beyond just what you guys are doing. So thank you so much for that. And thank you for sharing what you need from us, and we will advocate for you to get those things.
Oh, I have a longer list.
Send it. Send it. Please send it. This
I
is
was
so
told to keep it
important.
short, but I have a very long list.
Please send it, because this is so important. I think also just the story you told, like, that's, for us trying to raise funds, that's captivating. People, if we can show numbers, and, you know, everyone has had tooth pain before, everyone wants to take care of that. So I think just the stories you've told and the way you presented the numbers is really powerful, and yeah, thank you. for
Lovely,
that.
thank you.
Yeah.
Yeah, and I just want to thank you. Like, a very impressive presentation, what you've done, and how you put that together, especially with the stories, like you said. Really helped us paint a really accurate picture.
Right.
So thank you.
And now everybody knows how to spell one more word.
That's fluoride with a U.
Okay, well, thank you very much.
Did you have a budget that you give to Dr. Ariola? Do you have a budget of what you need?
Yes, I do. And I can provide that. I think I've provided you with like some primary numbers, so.
So thank you again. We could spend much more time on this. Thank you for the picture of your team. Please thank your team because it takes
They
a
don't know that's
village.
up there.
Oh, really? Well, that's a really good picture. So I think that needs to be put out there. But this is fantastic. Look forward to learning more. And I learned a lot. And so I really do appreciate your dedication, Dr. Smith. Thank you.
Awesome. Well, thank you. Nice to meet you.
And we look forward to that advocacy list too. And I know Dr. Ariel is going to share that. And yes.
Can I ask, do you, on the tooth, the ambassador tooth outfit, is like the logo, is our logo on that tooth?
The logo is not on the tooth.
We need to put our logo on the tooth. I just feel like all the public,
Branding.
yeah, the branding, that's amazing.
Okay.
Yeah.
We did create we made a logo magnet and we put it on the side of our van. And part of one of the magnets has the mascot on it, a picture, Pearl is coming to your school. And I will say, this group of hygienists, they made that costume. And not only is it just a costume, but she arrives with Velcroed cavities all over her. And as they brush, the cavities come off. And then at the end, she gets a tiara. Okay.
Thank you, Dr.
Thank you.
Smith. All right. Next, Dr. Areola, State of Public Health.
Yeah, thank you, Dr. Smith. I'll tell you the version of the presentation we listened to. It's a lot more detailed and thorough than yours, but we didn't want to keep you here for too long. So, excellent job that they do in our dental clinics. I will just refer you to the updates on the performance metrics. The first one, the big thing this past few weeks in the national landscape is the ACIP, the Advisory Council on Immunization Practices, changes to the hepatitis B vaccine schedule that was voted on last week. Basically, since 1991, for almost 35 years, the recommendation is that the first of the 3 vaccine doses for hepatitis B is given within 24 hours of birth. And then you get the second shot 1 to 3 months after, the last one 6 to 15 months after. And we like to remind people that before 1991, we were having about 20,000 cases of hepatitis B infections in the United States, and that's dropped to fewer than 20. And what that means for that virus is that we are ending up preventing a lot of liver diseases, from liver cancer to cirrhosis and all of those things. And so there's a huge concern in the public health world, where now the recommendation is that for moms that test negative for the HB antigen vaccine blood test at birth, that they don't necessarily have to take the vaccine until about 2 months after that. And then, of course, there's the recommendation now to consult with your physician, and parents play a role in making that determination again for those hepatitis B antigen negative moms. But then also there is the bigger concern where they're asking for titers test to see if the first dose of the vaccine does result in greater than the 10 milligrams per liter, I think, the required level of antigen and antibody in the body that protects against the proliferation of the virus. So again, you talk to a lot of people that have done this, including some of our local professionals over years. There's a lot of concern about that. Instead of, again, it's saying that instead of going through the 3 different vaccine doses, test after the first one to see if you achieve the required level. And we think long term that's going to be harmful to the health of our residents. We have a process that's proven to be very effective, that's worked very well for almost 35 years. And so the recommendations of ACIP goes to CDC director and then comes to state. So there's a push for acting CDC director not to accept it. You can make your deductions from what will happen on the state, but really concerning development in the public health world.
And that means we have to follow the guidance that comes down, correct?
Yeah, for the most part, it's so that the consequences include, for example, whether insurance company will continue to cover those, our messages will remain consistent, which is continuing to follow the AAP, American Academy of Pediatrics recommendation, which is for the 3 doses, and continue to encourage our residents to get their children vaccinated as much as possible. So our recommendations will remain the same.
Just had a quick question. Are there statistics on how frequently people go through all three as the current recommendations, or do you see most new babies get the first one and then there's fall off at round 2 and round 3 as it is now?
I can definitely check on that, but I'll be shocked if it is not close to being 100% compliant. And recently, in the past 5 years, we've seen a lot of vaccine hesitancy. In the past, it's always been, for different reasons, historical reasons, and different things. In the past 5 years, there's a lot of ideological, religious, and political leanings that's impacting uptake of vaccines. So I'd like to look at the number to see what we have, say, 6, 7 years ago, but everything's been distorted since COVID. But we'll look into that to see whether we have those kind of data.
But I was just saying, that's a good question, but for most children who do end up entering public schools, at least, it's a requirement.
Yes.
And so, therefore, it may not see a lot of kids dropping off, but I think, yeah, it would be helpful just to sort of see those numbers.
But also to see the impact of this on those requirements by the school moving forward. I'd
Yeah.
say,
Is it still will it still be under the VFC funding program?
That's some of what we need to figure out. My suspicion is if this is adopted by the CDC and it's pushed to the state and the states adopt that, which I don't expect the state not to, that's something we need to figure out. Yeah. Oh, Richard, do you have any information?
No, that's an interesting question, Dr. Ziegler, about VFC. I guess I'm just an optimist and everything is unprecedented. But if it's required for school, maybe if it's just not within that first 24 hours, but the 3 shots come later, I still see it being covered by insurance and by VFC
And I see, Michelle, you have any more you're shaking your head. Any information there? Okay.
Oh,
Okay.
good, thank you.
I'm hopeful, but I think because of the requirement,
Yeah.
it's still funded.
Yeah.
Thank you.
And that's what I have here.
Yes, that's what you have. Okay, all right. Thank you. All right, next, deliberation of memorandum of air pollution fees for the calendar year 2025. John Finke.
Good afternoon,
Mr.
Chair
Finke.
Franklin, members of the board. Welcome, Dr. Stovall. My name is John Finke. I'm the Bureau Director for Environmental Health Services. The next item on your list is to address the air pollution permit fees for calendar year 2025. That is not a typo. We are here to talk about this previous 12 months. The regulations that we have in place do define a fee that increases with the consumer price index each year. Right now, that fee would be $65.38 per ton of emissions from these facilities. However, the regulations also require that we not collect more than we need to operate these phases of our program. So we work with finance at the beginning of the year to determine what our budget is for this part of the program. Then as we get to the end of the year where we are now, we've seen what companies have carried their permits through the year, what their levels were, and we can back calculate to that price per ton that gives us the revenue we need. Since the facilities already know about the presumptive fee, they're expecting $65 per ton, so it's not bad for us to give them a discount. I would never go to them and say, hey, it's $80 instead of $65. We would never do that to them. So once we get to the end of the year, we come to you. We request a variance from Section 105680 of the Metropolitan Code. That is the one that outlines the fees, and we request that you grant a 1-year variance, making the annual fee $40 per ton.
All right, when ready, I will entertain a motion.
So moved.
Motion made by Ms. Whitehead. Is there a second?
Second.
Second by Dr. Griffin. Discussion. Yes.
I do this every year, I'm sorry. Here I go. So talk us through why, I feel like we should charge a lot more than what we're charging, just because of asthma, et cetera. So just talk us through why we need to keep
So
it at this
our,
rate.
our program is delegated from the state to do certain activities.
Okay.
These funds can only go to those activities. If there's something else we wanted to do outside of that, like a heat island project or something, those would have to be funds from somewhere else. We have lots of different funding streams, but the ones we're talking about are strictly for what the state delegates to us, and we can't go outside that.
Okay, so like, as California charges, say, $275 a time, that's because they have a different state government. What you're saying, it doesn't matter what we decide here, really?
Or it costs them that much to regulate out there.
I have to say I have the same concern because every year we charge a lot less than what's. So, I mean, is there something the program can do to use the funds?
I mean, we could hire more people and become less efficient. I mean, honestly, that's the answer, is we keep a very lean program. I only have the people I absolutely need, and we've kept our costs down for years and years. Once we get to that $69, you know, that's it. It's not easy we can't raise fees after that because that's the federal amount. So I've tried to keep that dollar down as long as I can because there are things like they're not cost of living, what are they? Annual adjustment, something or other. You know, those things come and we do have to have room to increase these fees over the next 10 years. So we've tried to just keep things as lean and effective as we can.
And so you said that you have the team that you need, so that means you have the capacity that you need.
Absolutely.
You can't overcharge because.
Correct. We are doing a pay study now.
Okay.
I'm fully staffed. I've been fully staffed since July 1st. So I have got my entire staff billing every hour they have and what business unit it would go to. They don't just clock in and out. At the end of 6 months, we'll look at these numbers and see if it justifies going into the spring a different budget number, and that's what we're supposed to do. But right now, for this year, the number was $40. It could be higher next year, and probably will be with the salaries that we've seen over the last year or two.
And we revisit this literally every year.
Every year.
So, and I do appreciate the education, so I don't mind us asking every year. Just make sure we help us understand. Plus, we have new folks that on the board. So, any other questions or comments? Okay. All right. All in favor of approving the one-year variance from the provisions of Section 10.56.80 in the Metro Code? All right, none opposed. Motion carries.
Thank you.
Thank you, Mr. Finke. All right, next we have Mr. Diamond, deliberation of grant applications.
Yes, Chair Franklin, members of the board, we have one application before you. It's for the Tennessee Child Safety Fund for car seats, and it's up to $1,000, and that's for the calendar year 2026.
When ready, I'll entertain a motion.
Make a motion.
Motion made by Dr. Ziegler,
I'll second.
seconded by Ms. Whitehead. Discussion? If there's no discussion, all in favor for approving the Tennessee Child Safety Fund application? Ayes have it, no nays. Motion carries. Thank you. And then we're moving on to deliberation of grants and contracts.
Yes, Chair Franklin, members of the board, we have two grants and contracts for your review. Item number one is our Public Health Infrastructure Foundational Grant. It's just an amendment to update some terms and conditions. And item number two is a donation to the Pet Pantry at MAC for $500. And for the newest member of the board, any donation that comes with specific restrictions or purposes have to be treated as a grant because we have to track every dollar of that to make sure that they are spent in that manner.
When ready, I'll entertain a motion for the consent agenda.
Make a motion.
Motion made by Dr. Ziegler, Seconded by Ms. Whitehead. Discussion? I do have a quick question. The amendment, number 1, strengthening U.S. public health infrastructure, workforce, and data systems.
Yes.
Grant amendment. Could you just give a quick high level of why those terms and conditions need to be updated?
Sure. There were two, and they were included in the packet. First one was changing it around from, and again, grant language, 45 CFR 75 had some flexibilities in it, and it just all falls now under 2 CFR 200. So there's nothing objectionable or controversial in this, if that's what you're asking.
No, it doesn't. It doesn't. What you just said does not mean anything to me.
Like I said, it's.
So is it normal? Is it their request, our request? What is the?
It's not our request.
Okay.
It's a federal thing. Again, it's just trying to, I think, put it under one umbrella as opposed to 2 umbrellas. Again, there's nothing conflicting. It doesn't restrict how we spend our money or where we spend our money or any of the projects that we have. So it's procedural. If there were any red flag concerns on our part, I certainly would have brought them to your attention.
I was just curious. I don't think I've
Sure.
seen this before. So.
And the second one is more of the same. It's just the subject determination just says, we have to, spend the funds only if they're appropriated, and they have been appropriated each year, as well as satisfactory performance, compliance with the terms and conditions of the award, and review by the project officers of the grant. So I have no concerns with the language in there, and again, I would have brought up if there was any material changes to the agreement or the grants, but there's not much here that other than just procedure.
Any other questions? All right, hearing none. All in favor? All right, none opposed. Motion carries. Thank you, Mr. Diamond. Now we are going to the report of the director.
Thank you, Chair Franklin and members of the board. First of all, Katy, did I just call you a different? All right, that's Katy Gumbley.
I was like, I don't remember her name being Michelle.
It's December, so I'm sorry. It's Katy Gumbley. She's our Assistant Director of Nursing. I wanted to correct that. And also to add to Dr. Smith's presentation, you will note that a few weeks ago we started sending out what we're calling public health notes, where we're highlighting our programs and including some of the data. I think that will make more sense to you now that you saw the presentation. We had done one on that. And if you have any, and we're pushing that out to the community also, just so people understand the breadth of what we do and the different impact that our staff are having on the community. Also, in this, even though I only talked about the federal landscape, but all the updates about the performance metrics are included here. If you have, I'll just talk about some of them. For example, the community violence, I do want to talk about that. The mayor should be making the announcement very soon. He has appointed 31 members of the community to serve on the task force, and I hope I'm not jumping ahead of that. So our team has been, there's some information in there for you, including this, which is our 2 consultants that we're working with. This is going to be a very, very, it's going to be driven by the community, and so there will be heavy community engagement. So our consultant that's kind of overseeing the community engagement, you see our information there. And we have a different consultant that's kind of facilitating the work of the task force. It's our intention to begin the process in January. Yes, it's been the logistics, so you see kind of the timeline. There will be a lot of opportunities we're hoping all of you will get engaged. So many conversations with community organizations. I've been personally impressed at the interest that's generating in the community. And so if you have questions about that, please look through and ask us. But we're hoping that you guys will be a part of that. I also want to point to, we are presenting to you again another 3 detailed information about 3 of our grants. And so I know the fee grant that you actually asked for is one of those. And so there's one about our chant program and one about our fee grant. And then the last one is about a school-based dental program that you heard about. So just very basic summary of funding, what that captures, and some of the output things there. Again, I think that we previously shared 3 or 4 with you. And if you have questions, again, just trying to do our best to respond to your request, but also just so we keep you informed about the different programs that we're working on. I've talked about the Measles program, really very impressed with our staff, reaching out to over 700 contacts. And the good news is we didn't find any additional cases, so that's good. We've talked, this is, I think, is very important. We, for the second time in 5 years, one of our school nurses was announced as the School Nurse of the Year by the Tennessee Association of School Nurses. And that's Nurse Briley, who works at Shane Elementary in South Nashville, offering health services to students and educating community every day. In her nomination for School Nurse of the Year, her anonymous nominator applauded her compassion, dedication, and teamwork in everything that she does. She is the second, again, team member of the school health team in the Metro Public Health Department to be named the Tennessee Association of School Nurses in the past 5 years. So we do recognize her contribution there. And I also want to kind of point to what you are saying. You see that beautiful van or bus. RV. So,
We call it a yacht.
yeah. Hopefully you can take a ride in one of those with us in the next few months. We're actually working on getting one of those to enhance our mobile services in the county. And want to say 1 or 2 things?
Yeah,
okay.
so with our recently reinstated TLC funds, I've been working a lot with Laura and Katy and the team at Clinical Services who have really wanted this to be a dream come true, and it's happening. So we found a contracted vendor. It's going to be a 2-exam room unit. It's pretty standard. They had one ready for us, and so we're going to be able to get it hopefully around next May. And then the staff's #1 ask is driver training, so we'll definitely do that too. And we'll leverage partnerships for where to park. Our staff, we won't need to increase staff. They'll be rotated through the Lentz, Woodbine, and East Clinic staff. We'll also have our mobile team on there giving vaccines. STI folks can be on there. Anything communicable disease, especially related, we want to make sure we have offering because of the funding source. So we want to make sure we tie that into. But it'll be infectious disease, preventive health services, and hopefully just a really cool expansion of services out in the community.
Yeah, and we did give extensive thought about resources and staffing before we proceeded with that. So we think we're in good shape and being able to take services to the community even more. Yeah. Now, in that slide also, I wanted to point out to that lower picture with our 2 staff there. Is those are our latest winners of the Daisy Award, which are given to nurses who demonstrate the willingness to go above and beyond. In November, Emily Lowry from our school health team, and Gloria Morrison from our fetal infant mortality team, and I believe Gloria is to your left there, right? I took a picture, but I think Matt decided not to show my picture with that. Yeah, no, I know, but I took it with the guys who got there. I'm kidding. I saw this before it was posted. I was kidding, but really, just tell you that it's a lot of these efforts are to recognize our staff who are doing the right thing, and I'll share that later. But with our AP team and our FEMA team, just looking through some of the reports that I'm seeing, capturing stories of the impacts that we're making in the community. Just wanted to point that out. And if you see any of our staff that's been recognized, please pat them in the back, let them know they're doing a good job. Yeah. And I do also want to mention that we have deployed, I believe, 3 new Narcan vending machines in the community. And it's been in the news, and you see some of the information here and about where they are placed. I've talked about the mobile unit, and I've talked about the community safety plan. And the last thing I really want to emphasize is, do I have any more slide, Matt? I don't want to, okay, all right. Is our Metro Animal Care and Control. We did send out, we did eventually got a new director there, Daniel Carter. It's been with us for a while. It's been the acting director there. And so congratulations to her. We think she is the best candidate and understands the department, understands the staff, and really compared to several years ago, we are pretty happy at the direction of the culture at the Metro Animal Care and Control. So we congratulate her and look forward to working with her. And that chair is I forgot one. Because I did Dr. Shokakai. This is the 3rd one that she has done. One of the things that we've pushed, I personally have emphasized, is the need for a commitment to continuing education. Many of us, probably greater than 90% of us, come into the health department with different trainings, without trainings in formal public health work. And so we learn public health through practice, which is a fantastic way. But, continuing education classes are a way of us to continue to increase that knowledge and to build on what we learn through practice. And so this is the 3rd one since I've been back. And I was there yesterday, and the level of attendance and the level of enthusiasm. You see people physically there, but also understand maybe about 30 people who are virtual participating in the and different topics. I think this one was more about substance use, and it was really impactful because people can identify with that. You have friends or family members that have been impacted, and again, Dr. Shokaka and her team, excellent work, impactful work, and so that's the last thing I wanted to say. Thank you. Go ahead.
Could you give us an update on the discussion we had last time on the MAC, a separate board for MAC?
So I believe there were several conversations. I believe the bill passed. I will be meeting with Councilmember Sherry Winner on Monday to talk through opportunities to discuss that even further, to look at opportunities to take into consideration the letter that the board wrote to her, and I believe there will be. I will provide an update after speaking with her. I believe there is willingness on both sides to explore that and see how that can be to the benefit of MAC and the health department. I will have more to say next time. Yeah.
So if it passed, as it's written, it's another entity that's being convened. So is there a fiscal note attached to it? Or is that part of the conversation? Because as it's written, I don't think that there's a lot of wiggle room. Someone's going to have to staff this and do all of the things that we outlined in that letter.
Chair Frank, I think we've made it very, very clear that we don't have the resources to staff that. I am unaware of any fiscal notes attached to it, but I'll just say I believe that we will have an opportunity for productive interaction, and so let me report to you back after that. But there's been conversations that we've had, and I look forward to a productive conversation with her.
So I want to offer congratulations to everyone that you mentioned, Ms. Briley, Ms. Lowry, Ms. Morrison, and also Dr. Shaw Kai Kai, and then Ms. Carter, Danielle Carter. My question, though, today we found out in South Carolina there are hundreds of folks that are being quarantined for measles. Can you sort of give us high level what's going on in Tennessee, and is there anything that we should understand or just be looking out and communicating with our networks regarding?
Right, so I actually think Tennessee has been unusually lucky with the measles case, because the first set that we had, mostly in West Tennessee, they were also very controlled, limited, didn't quite spread. I'm not aware of any additional ones in Nashville case.
There's no
Yeah.
Tennessee cases
Yeah.
right now.
Yeah.
So we're good. No orange flags
Dr. Wright,
for now.
Remember Dr. Wright, he texted me today and said, I'm thinking about y'all as we just got our 120th measles case.
He's
But
in
it's
South
He's in
South
yeah.
Carolina.
So for you to
Yeah.
say that.
And do we pass the 21-day mark or whenever?
Oh, yeah,
Oh, yeah.
the Friday after Thanksgiving.
Yeah.
We've been very lucky. Measles is, a very, very contagious virus, and everywhere that's been, it spread spread a lot. And somehow I will say our fingers are crossed. And the thing about it's very resource intensive, as you can see. That singular case, over 700 contacts. So hopefully we're able to stave that off for whatever reasons. But yeah.
One more question about the mobile van. Is this considered like, for a health department our size, that most places would have a mobile van like that? Or can you talk about how you thought about it and how we can like monitor what's going on, what's happening, and advertise or like promote it or what?
Yeah, I can tell you that the last two places that I've been, we had one like that. For one, it's going to be huge Metropolitan Health Department logo on it driving around. But bigger than that, it's we have to be creative in how we provide services. And actually, I think a long time ago, for those that have been here, we used to have vans like that at the old Lentz, didn't we, Rhonda? That were, and problem then was who would drive. I remember those guys in pest management were the ones driving around. But the problem I've seen in most places is not just the van, is the resource to keep it, especially since we are resource challenged. That was my biggest challenge to our staff, to look at the resources, and they came up with very creative ways to make sure that we maximize the resources that we have. And we're going to do our best to make it a priority, as we know, again, we throw out the phrase social determinants of health, but in practice just means that, some people, it's easier when we take the services to them to access the. So we're going to keep that as a priority. To your other point, how do we keep you informed, making sure we are tracking what we are doing? We will definitely do that. I have no doubt that it's going to be need for resources to maintain it moving forward, but it's a priority for us.
I have a question. Can you speak to the Woodbine and Mac locations? Like,
Yes.
I thought this, 6 months ago, we'd found locations, and we're still looking at locations, so.
We find locations every year.
But it was,
And they're
so
looking
maybe
for more.
explain the process of what happens when we
so
find them, because I don't know.
Yeah, so actually I would change that every year. I change since I've been here, it seems like we find a location every month. But, these things are fairly complicated. So what General Services, what they would do is send us a list of potential sites.
Right.
And then we'll go and look at the site and say, we like this, we like that. And
Right.
then they go back and look at it and look at feasibility, whether it's buildable or it's not, and the challenges there. Actually, I had a call with them along with Jim and Laura last week, where I asked them to kind of change the process, because right now I'd rather they do some of those preliminary work before I get excited about the site, and then I figured out it's not feasible. Now, the last site that we've told you about, that's in the works. So what we've asked them to do, there might be a need for some zoning changes. That doesn't bother me. But if they have some concerns about whether we can build on it, I want them to resolve that first. We looked at it, looks flat, looks good. It's about what is it, 10 acres. It fits very well within our budget, and I had the same conversation with the mayor and his team about it. Everybody's cautiously optimistic, but I won't bring that to you because of what happened the last time until we get to a point. But we are looking at the site, trying to do some preliminary work. And then the beauty about this site is we have enough in the budget or in the capital spending budget to not just purchase, but to begin planning. But you'll also note that there's additional money in the mayor's capital spending plan for both MAC and Woodbine. And met with John Finke earlier today. We're also doing the same thing with MAC. There's a list of facilities that his team is going through to look at. So, you know, from my experience, just working with government and dealing with this, it goes at government speed. Yeah.
And so do we have a timeline of how long this assessment feasibility will take?
It is it is completely in the hands of General Services. We don't, but there's some concrete steps that they are taking. We're meeting with them on a regular basis. My suspicion is we'll have something to tell you in January. So for Woodbine at least, once we identify a location and we, I don't know, Jim, did they ever turn in the letter showing our interest in the property? Are you aware? Did they do that?
I don't believe so.
Okay.
I think they're still
Yeah. Yeah, there's just some issues that they have to sift through. But what I've asked them to do now, though, moving forward, is instead, before they send us those facilities, we're asking them to do some of those preliminary work to make sure it's actually feasible before we have to go.
Awesome. And then I just wanted to thank you for giving us the grant summaries that you're giving us. We've been asking for that for 2 years, and it's very nice to have that finally. So thank you.
Thank you.
Great job.
Going back to MAC and the new Woodbine site, I know historically council members have weighed in. When have any council members weighed in about preliminary considerations? And if not, when do you anticipate them weighing in? Because that's also been something we've had to navigate before.
Right. So that's engaging elected officials, engaging the community around there is an important part of the process. It's difficult to do, though, until you zero in on the property, and it's shown by expert, not us, the general services people, that we can actually build on it, and it's feasible. And so the last one that we saw that I shared with you, we had already engaged the mayor's office, understood who the council person is, and mapped out a strategy for engagement. But we had to pull back because it wasn't something we could proceed on. But yeah, I guess your point is that's part of the process. Once we zero in on 1 or 2 properties, then that's one of the steps that
I just hate to get so far in and then there's a council member that lifts up concerns.
Yeah.
And you know what I'm saying? So,
Yes,
yeah.
yes.
Okay.
And
Just-
our expectation is there will be concern, so it's part of our job to work with them as quickly as we can, yeah.
Okay.
Yeah.
Thank you.
Yeah.
All right. Yes.
So I just want to also shout out the nurses, the nursing staff. The Daisy Awards are very competitive, so congratulations. And I think it was only a year ago, I was at the medical services retreat. You guys talked about this mobile van as like an idea. So I've never seen this happen so fast. So congratulations. And also to what's been shared, I think it's a great way for us to be in the community. So I think that's going to have long-ranging impact.
We
So
want to do a big
Yes.
unveiling media release, you know, look for us, reach out to us if, you know, if you want us in your neighborhood type thing.
yes,
I want to
like
know who's
birthday
going to
parties
drive
over.
it.
Yes.
That's all.
Yeah.
So,
You are allowed to come and drive.
So thank you all so
I wanna
much.
Shout out our facilities team too. They're already working to make sure we get an electrical hookup in the parking lot here at Lentz with an easy kind of parking access so that we can come in, not a lot of reversing and getting in a small spot. So
okay.
it's a team effort.
Thank you. Okay. Okay, anything else for the director? Okay, all right. Next, we'll move on to the report of the chair. I just have a few things, high level. One, what to expect early next year in advance of the department submitting the budget, our departmental budget to the mayor's office. Dr. Ariola is going to share that with the board, so we'll know if it'll either be January or February, so just stay tuned for that. And Dr. Ariola has shared that he has heard our requests for advocacy. So in terms of advocacy requests, you're going to be able to share that with us in the new year.
Right, latest between, we're going to,
Anything about just high-level
yes,
public health?
yes, very early in the new year.
Yeah.
Let you know what the request are. Yeah.
But notes and talking points. So that'll be really helpful for us to be able to sort of lean into our roles. And so thank you, Dr. Ariola, for working to make that happen. The Metro Public Health Department Foundation, the department is moving forward with positioning for that. So hopefully maybe by March we'll hear something more. What else? So I just wanted to say thank you. I see Beverly Glaze Johnson here, point of privilege. This morning we saw the health announcements, and there was an announcement about the Ryan White Part A program in partnership with Delta Sigma Theta Sorority, the Nashville Metropolitan Alumni Chapter, to essentially do this volunteer work in the community. So it's providing gloves, scarves, socks, coats for people that live with HIV that are in need. And that is going to go through, the collection is going to go through February, early February? Yes. Yeah. So thank you. I found out about, Beverly told me about this the other day and said our sorority is doing this. I had no idea. This was really driven by you, so I just wanted to say thank you. And it was really nice to sort of see that in the health announcement. So I'll be making my contribution. So thank you for, yeah. And then next week, we have our organizational change management training. You should have a calendar invite for that on Thursday. And that's all I have. Any questions? No.
Wear your Christmas tie.
I will remember, we gotta remember that.
All right, next we have election of chair and vice chair. And I'm going to turn it over to Derek to, again, explain the process.
Recommend that on this action item, you open the floor nominations, just so that you can have nominate yourself or another person. Nomination doesn't require a vote or a second or anything. A nomination is a nomination. I also recommend that you handle nominations first for the position of chair. Depending upon that nomination, I may have subsequent advice about the current chair passing the gavel to if she's subject to a nomination, to a non-nominated member to call for the vote. Each one of you is entitled to cast one vote for one of the nominees for the chair position. I believe that'll cover it.
Okay, all right, thank you. All right, I'd like to open the floor for nominations for the position of chair.
I would like to nominate Chair Franklin to be chair.
Okay. Are there other nominations? All right.
I'd like to nominate Dr. Griffin.
I would rather,
No.
right.
Are there any?
I'm going to vote for Dr. Franklin.
Miss
Miss
Frank-
Franklin.
Miss Franklin.
Miss Franklin.
But,
That's how you're
yeah.
Not yet.
Hey, but at least it was done publicly as opposed to behind. Are there any other nominations? Okay. I hereby close this nomination. And then, now I'm going to,
Vote for the one nominee.
so I'm going to close this nomination and I am going to recuse myself as chair and pass it to vice chair.
Okay. Do I have to open anything?
Just call it.
Okay. I will call for a vote for chair. Just an aye. Who
It
approves?
has to be a roll call, by the way, no each vote.
Nomination for Tanae Franklin to be
Yeah,
chair.
for Tanae Franklin to be chair. Unanimous?
So roll call, do we have to,
She could say unanimous,
okay, all right.
but just so it reflects that there was each member voting for you as chair.
All right, so motion carries?
Motion carries.
Okay. So next agenda item is, or next consideration rather, is for vice chair. So I'll open the floor to nominations for vice chair.
Can I nominate Ms. White?
I'd like to nominate Dr. Griffin.
And I like to nominate Kara Ziegler. Are there any other nominations? All right, I hereby close nominations. I think since we have 3 individuals, one, we need to see who is willing to accept the nomination and who is not willing to accept the nomination.
I'm not willing to.
Okay, so that leaves us with Dr. Griffin and Dr. Ziegler. Both of you all
Yeah.
are willing?
I won't accept.
That's not fun.
Like but no, she's probably gonna be traveling somewhere. No. Okay, so you're not accepting? Okay. All right, so I will call the vote. Since Dr. Griffin has declined, Ms. Whitehead has declined nominations for vice chair. All in favor of Carol Ziegler as vice chair, please raise your hands and also say aye. The vote is unanimous.
I think you have to vote too.
Oh, you have to vote? I know,
Feels yeah.
I know. Raise your hand if you're sure. I watched a whole bunch of 80s commercials the other day, so, all right, a motion carries. All right, thank you, Dr. Ziegler. Thank you, Dr. Griffin, for your service, and I know you're not going anywhere, so it really doesn't change anything, so, but we will consider positions again next year at this time. Okay. All right, our last agenda item before adjournment is new business. You have in your packet the board requests of the department and departmental requests of the board. We have a running list. I'll just give everyone a moment just to review that. I don't think we have any board requests of the department that came out of today's meeting, with the exception of making sure that we have branding, Metro branding on the tooth.
Yeah.
So,
We asked for
on the
update
mascot.
On the MAC.
So that's
That's on the
continuous. Yeah, that's continuous. Yes. Yeah.
actually in the report. What I
Right.
No, what Dr. Griffin asked about.
About the van, I asked for,
No, last,
You're talking about
Oh, right.
the new committee.
yes.
yeah, I don't know what
With-
it's called.
yes,
Sorry.
yes.
I'll report to you after my meeting next week.
Yeah.
Yes, yes,
That was
yeah.
the request, right?
Yes, yes.
Okay.
So we had talked before, and I don't remember the timing, about that report that we get and the strategic plan, all these things being aligned.
Yeah.
Timing for that and with the budget, like what should that look like for us to be most efficient moving forward? I guess
I think
that's,
we agreed to March, right?
Yeah.
does that make sense?
Yeah, it's March, and we're going to work on updating that to you by March. But again, we will provide you with what our budget ask priorities are by early January and talking points on how to advocate. So, yeah.
This reminds me, I mentioned to you, Dr. Ariola, that we'll need to sort of start thinking about dates for a retreat. Our last retreat was in March of last year. And so I've asked Dr. Ariel's office to take the lead with scheduling that. So just be thinking about your schedules next spring. And I don't know, I have no idea when, but just it's coming and we'll probably need a really good chunk of the day. So, yeah.
So, just question.
Yeah.
We will, so, when is budget due? Is it May?
They're actually going to ask us to, probably they will ask us to turn it in by February, early February, right? What do you think? Go ahead, Jim.
Yeah, the budget kickoff is January 7th, I believe, this year, and then they'll give us further instruction on when things need to be turned in. But it's usually a pretty quick turnaround. They'll tell us what the mayor's priorities are, and then we'll put our packet together and make our submission, usually by the end of January, early February.
So why are we waiting until after that?
Yeah, the report actually does something different, and I kind of know where you're going. That's why I said what we're going to give to you early January is going to answer your question. What we're going to give to you will be priorities, what our budget asks, and how to help us advocate. The report is largely providing, I know the intent was, can the report be what we take to the mayor to ask for things? But that's not really what that report is doing. The report is just talking about our different programs and what is done. But by early January, you have what you want, because, yeah,
Well, I'm looking for outcomes, right? So if we're asking for money,
right.
we would want to say, here's what we've done. We've been good stewards of the money,
We
right?
have-
And
we will provide
And,
those.
yeah.
that, and so that's, I think that's
And
what
so
we're trying to align.
So this is really helpful. So when you present the budget to us, it looks like it might be January, based on what Mr. Diamond said. I think you have an idea of the type of questions that will probably be coming. So if you, and so I think it makes sense for us to just sort of make sure we submit our concerns and questions. So Dr. Ariola can take that into consideration. But I do recognize what you're saying, that the processes are somewhat separate, right?
Yeah, so part of what I'm trying to say is that the way that Metro budget works, we're going to, from around January 7th, they're going to give us timeline of when to submit, which is largely the budget as is, but also improvement request, which is really what I think your question is getting at. And so we already started internally several weeks ago. We have all the different programs, look at their program and provide a listing of what they need. You've also seen some of that around sexually transmitted infections and TBs, which, by the way, after we finished, so some of what we have in the performance metrics, we're already winding them down. Whenever we have the opportunity to do the same thing for tuberculosis, you will see that. But our staff kind of evaluated strategies and look at newer strategies that we can do, and that's what's going to drive our budget ask for those programs. And so that's going to be provided to you, I believe, early January, including the outputs and the outcomes. Just another point, though, is that for health, those outcomes typically they don't come immediately. So you will see probably a lot more strategies, goals, and outputs, but outcome targets maybe. But just so, again, the flexibility around Metro budget is very, very small, very, very small. So a lot of our budget is largely salaries, very little room for growth. And also the other complications there are programs where we are simply almost like pass-through, where we don't have direct control, but because it's related to health, it's in our budget, but we pass the funds through. But I hear you. What you need, we will provide as much as we can by January, and a meeting. And if you have further ask or questions, then we'll respond to that. But it's what we do when we do it is going to be driven by downtown, not than us.
So let me ask a question,
Yeah.
just to sort of
Thank you.
piggyback on what you're saying. In general, does the mayor's office consider outcomes, impact from metro agencies when they submit their budget? So just in general,
Yeah,
how do they understand that type of strategic alignment?
Yeah. So to be clear, we talk to the mayor's office several times a week. So when things go there, it's not, at least for me, my goal is there are no surprises there. And, but also understand that there are competing priorities across what's a very large government entity. I think the capital project, for example, the Woodbine and the MAC replacement is just two of several things, including building new schools, that the mayor has to contend with. And that's also true for programs that we request for. But as I've said, this past year, extremely grateful and appreciative of the mayor working with us. We combined, we got over $3 million in improvement, helped us offset a lot of the things that we lost in grants because of federal decisions. Do I think it's realistic to expect that level of improvement this year? Maybe not. And actually, the feedback, we had a meeting a couple of weeks ago with Finance and OMB. The feedback is that, maybe revenue projections not quite as robust as it needs to. And so those are, but we're still going to make our ask. Maybe we're going to set priorities, and you'll see that as we do the high priority, low priority. It doesn't mean that we don't need those things. It just means that where we have, they have to choose. These are the things that we prefer for them to do, not because we don't need the rest of them. But I'm pretty sure that a lot of your questions will be answered once you see the priorities and the justifications. It's a lot of needs across the department. I also want to emphasize that we're not just asking for money. What we talk about every day is to evaluate our programs, evaluate our strategies, and if we need to reallocate or reassign resources, we are doing that internally also to make sure we're making efficient uses of the resources that we have. But we're one of maybe 50 different departments in the county, and I don't think there's any ask that will go to the mayor's office that they haven't had from us in the past. And it's a collaborative process.
I guess this is an ask. Ahead of that, are you all going to think about programs that are really effective that you want to scale up, like the dental, the Nashville Strong Babies, like things that we could scale up through if it's personnel, having more folks on the ground, people on the ground, like the mobile clinic. So is that, I think we should be bold about asking for more funds for those things, like with measles happening. I mean, can we get more people on staff? So I just want to encourage us as we ask, if we have that data, to really be bold with what we ask for, $100 million. Like, make a big ask, because the work you guys do is remarkable. And just the measles, the dental, the behavioral, all the stuff that you guys do, I think they don't pay, they're not paying enough in for it.
And that brings visibility, even if, maybe not 100 million. They might say, well, but at least it's more education about public health. So I receive what you're suggesting.
So you will see every request that's been made by our bureaus will be in what we share with you, and I will make all of those asks. I will, though, also prioritize. I know how things work. So I don't want, you give an example. So one of the priorities this year in the performance metrics is to look at our tuberculosis program, our TB program, as well as our STI program. Our TB programs work with our AP team, look at the data, and I've challenged them, as I did the STI team, to review literature, talk to their staff, and come up with new strategies so we can change the trajectories of those infections. And they have done that. And so in my mind, we've closed out the STIs because we presented that to you, but that's going to drive some of our asks to the mayor. It's the same thing with the tuberculosis program. So we have a list of asks based on those performance metrics. But I also have asks with the school-based programs, school dental programs. I have asked with preventive clinics. I have asked with animal control. I have asked across the department, because we just haven't funded the programs a long time. We have grants that are running out in the next 1 to 2 years that we're looking to move from grants to local. So part of the reality is it's not going to be built in one day, but we'll keep asking. But when I speak to the mayor's office, I'm also emphasizing the priorities, just based on where things are.
Okay, that's awesome. And then I think, too, if it would help all of us, if you all think of, like, moonshots for your programs, like Dr. Ann, all these things, and then whatever is deprioritized, and I get that, if then you give those things to us, so we can prioritize those things with, like, the foundation work happening. I just think, I want you all to think really big, and then let you sift out what goes to the mayor's office and give the rest of it to the board, maybe.
Also, early next year, we've actually had, led by Christian, Zach, done a lot of work around the MPHD Foundation or Funds for MPH. So we're going to be presenting where things are. Lots of conversations with partners in the community. Actually have a very nice PowerPoint on the concept, and so you guys can see where we are, but also provide feedback. We think that we have like a one-year plan throughout 2026 that will get that going, and I know she's met with a few of you also. So we'll present that to you, and we hope to also build that and make that a significant funding stream moving forward. Yeah.
Thank you for shedding light on your strategy.
Thank you.
Appreciate that. If there is nothing else with new business, I will entertain a motion for adjournment for the Board of Health meeting.
So made.
So made by Dr. Ziegler. Seconded by Dr. Stovall. All in favor? All right, motion carries. Meeting adjourned. I hereby open the Civil Service Board meeting. Oh, I'm sorry. Okay.
Change.
Yes.